As many Americans are isolated and concerned about the future amid the spread of the coronavirus, managing one's mental health is vital now more than ever. Here's One America's Jenn Pellegrino.
Dr. Sue Varma, you're a psychiatrist up in New York City. Thank you so much for joining me today.
My pleasure. Thank you for having me.
Well, Dr. Sue, I'd love to understand what it's like up there in New York. Obviously, you're at the epicenter of the coronavirus right now, over 2,500 cases and growing by the hour. What's it like in the city at this time?
So New York, the city that once we say never sleeps, is kind of sleepy right now. And Broadway went dark a while ago, and all of our games and entertainments and usual outlets, and now restaurants and bars are very limited in terms of what you can get. And you don't see as many people on the streets, of course. It's really hard for many of my patients adjusting to this new normal. And it's interesting to see some people deal with anxiety by panicking. Some people deal with it by hoarding and buying up supplies in excess of what they actually need. And some people shift into a denial. So they want to say that, this is not real, this is not happening. And we want to really be careful with those people because they're sending the wrong message that just because you're young and healthy, we now know that 40% of people between the ages of, 20 and in their 50s are getting sick. This is something that affects all of us across the board.
It does. And, the conversation began with everybody wanting to know the medical side of things. Am I susceptible? What's going to happen if I get infected? What do I need to do? But I think it needs to shift now because there are a lot of people, obviously, in isolation, people that are concerned about job loss, financial concerns. That's a different America that we're living in right now. What do you recommend in terms of navigating that?
Yeah, so I think it's really going to be important that we keep the focus and the conversation on our mental health because we know what we need to do, or we're learning still what we need to do. Obviously, we need more tests. Now we have to figure out what to do with our time at home. So I would say to follow a routine as much as possible, have structure in your day, if that's possible, to what your work used to be. Try to spend 20 minutes completely unplugged. If you have an exercise mat, get on it. If you believe in meditation, great. If you don't, then now is the time to start believing. There's so much value in 10 or 15 minutes, calm, Headspace. A lot of them are offering discounted, especially for health professionals. Headspace is free now. Peloton is giving a 3-month free app for exercisers, even who don't have bikes. So there's a lot of resources available. Stay connected, use your FaceTime, do scheduled calls with people if you need to, text people, check in with the elderly folks if you're able to offer help and support by leaving groceries. We know that altruism and social support is a really big part of community resilience and people getting over things. And then take it day by day. I would say be informed globally, but act locally. So get text message alerts to what is pertinent to you. Your phone doesn't need to be bombarded and inundated with what's happening halfway across the world.
One final question for you, Dr. Sue. I know you're busy and you have to get going. There are people out there, the numbers are going by the day, that are getting diagnosed, or they have loved ones that are getting diagnosed. How do you recommend they navigate this situation?
I think that everybody should start having a plan in place in terms of if they were to get diagnosed, what do they need to do? How are you going to self-quarantine? How are you going to get people food? Planning, preparation, prevention is going to be a big part of it, and not to burn your resources. So if one person is sick and then there's a caregiver who's got to take care of 3 other children, are there other people in the community that can help, that can give respite? I know that so much of this is hard because we're not able to have the face-to-face contact, but get food, get provisions in place as much as you can to be prepared for that situation to happen if it does.
That's great advice. Dr. Sue, thank you so much for taking time to join us today, and stay well.
Thank you. You too. Take care. Bye-bye.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.